So our next speaker is Ellouise Simpson. She's a passionate and dedicated registered dietitian with many years of experience. She works in the NHS and private sector. She takes a holistic and realistic approach to help clients manage a wide range of concerns such as weight management, family nutrition, high blood pressure and cholesterol. Her main speciality is diabetes care. Ellouise guides clients by adapting their cultural foods, the meal planning and alternative cooking options. Ellouise supports individuals to understand the relationship between food and explores the causes of unhealthy eating habits and how to optimize nutritional intake through disease. Using her extensive nutritional counseling skills, she helps clients to achieve better blood glucose control and improve their quality of life. So I'll let Ellouise do her speech.
Thanks for having me today. So I've decided, because I've got to stand, you've all got to stand. Yeah? No, I'm playing. I was thinking of putting a song on so everyone can get up and break up their sitting, because we've been sitting for quite some time now. So my presentation today is all about glucose spikes, and I don't know if anyone's online or social media. It's a very hot topic at the moment. And the information out there is for all people, not just for women. I'm taking a bit of a stance in regards to looking through the diabetes vision, because obviously I'm a diabetes dietitian and I get these questions quite a lot. But we'll explore it a little longer. So let's see, how do we use this? Lovely. Okay, so we're going to do, talk a little bit about diabetes. That's just going to be a whistle-stop tour, because you probably all know quite a lot about diabetes. And even though we probably know some stuff about diabetes, there's so much research out there, especially when it comes to type 2 diabetes. It can just be, how can I put it? It can just be put in a box of, just a bit of lifestyle and a bit of weight loss. But really, it's not. There's so much more to type 2 diabetes, and it is very complex. Then we've got the continuous glucose monitors. That's going to start the debate. I don't think we've got enough time to do what I probably wanted to do, but if we can get a bit of a conversation going, that would be really good. But I'm not going to keep you too long, because I know that we're running so far behind. Explore a few of the current trends and some of the research behind it. Then we've got a case study, which it might just be we take home and we could discuss it online if we don't have enough time. And then a little bit about my summary. So I'll say from now, this can be quite controversial, okay? It's a topic. Right. So we've got diabetes here, okay? And it's just, the simple terms of diabetes. Typically, it's hyperglycemia, isn't it? It's really looking at how can we manage someone's blood sugars, and we don't want it to stay chronically high, because if it stays chronically high, we know that it can cause long-term health effects, and then it's a progressive condition, okay? And then it can lead to other things. With diabetes, your pancreas either doesn't make enough insulin, or your body can't use insulin it has effectively. So they're the two really important factors. So a lot of people might know a lot about, insulin resistance, but type 2 diabetes isn't just about insulin resistance. It's insulin resistance, and then you've also got it coupled with the beta cell dysfunction at the same time as well. I think I'll stay standing here. Okay, so we've got diabetes here, and there's a lot of time people just know about the commonly known ones, which is type 1 and type 2, but there are so many other ones. You might have a gentleman, he comes into clinic, he looks quite lean, might have a tiny pot belly, and you might think that's down to insulin resistance. However, you could have someone who comes into clinic and you make that automatic assumption and think, I don't understand how you've got diabetes, but it could be due to beta cell function, and that's now been reduced from a genetic factor. And there's also so many other things. There's a lot of hypotheses to do with why people develop diabetes. So you've got your insulin sensitivity, you've also got the beta cell function, and then we also wonder is, if you've got a lot of triglycerides, circulating in the body. Is that the reason why the beta cells have stopped working? Yeah. You've also got the fact of sometimes people have got a lot of just blood sugars circulated, and is that another reason why, blood sugars of diabetes has started to develop? So there's a lot of questions out there, and it's not just simple. And I think for me as a clinician, I always So do you remember I said I was going to put a song on? Now it's time. Shall I keep going? A little bit closer. Look at that.
It's the people at home. They're just.
Oh, right. Okay. Cool. Right here. See, I'm using that muscle. Using those muscles now. Yeah. So this is, as I said, today's a whistle stop tour, but we could be talking about diabetes all day, for the whole day, really, because there's so much that goes on and plays a role in diabetes management. So, why is it important that we want to maintain, homeostasis when it comes to blood sugars? And really, fundamentally, when you go and see endocrinologists, if you do have diabetes, it's all to do with preventing complications. We want to ensure that we're preventing complications and trying to keep it all at a balance. Yeah, so we're reducing the main causes of mortality, morbidity. But then really that's a little bit downstream, isn't it? It's kind of, you've got a situation and you're trying to look at the symptoms rather than the cause. Okay, so this is where it starts to get a little bit controversial. So this is just some information for your own references. It's all to do with blood glucose targets, okay? So people without diabetes, which we don't talk about quite a lot, you have to excuse me, I'm out of breath. We've got some figures here in regards to what their blood sugars should be like. However, there's a big however here, the research starts to increase as someone's developed type 2 diabetes. As we come to this end, the left-hand side here, the research is a little bit scanty. There's not that much research in there, but you'll know why I've put this on a little bit. So this is the blood glucose target, and then this is the diagnostic criteria here. Okay. So this leads me on to the common trends, the things that we're seeing in social media. I mean, has anyone seen all the information about, continuous glucose monitoring? I've stayed very quiet on social media about it because I've been doing the research behind it, but I find it quite fascinating, everyone's views on it. And I mean, is anyone for it or is anyone against it? So what's anyone's views? 50-50? Is that for? That's for it, okay. So let me rephrase that question. If someone doesn't have diabetes, are you for someone using a continuous glucose monitor or against it? So raise your hand if you're for it, if they don't have diabetes. We have one. Okay. And if you're against it? Yeah. So we have a high percentage of people sitting on the fence. But if I was to have counted, it still would have been more that were against it. And that's what I'm seeing on social media. However, so before I go into that, so you've got I thought I would just show you the difference between the two. Because a lot of the time people talk about continuous glucose monitors. They're the ones that continually, give you the feedback in regards to your blood glucose levels every 5 minutes. You don't need to do anything. But the flash ones are the ones where you have to use you have to scan them using your phone or a sensor of some sort. I think they're quite expensive if you don't have diabetes. But someone could question, if you're invested in your health, how much is too much? Okay. Right, so before I click on to the next, what trends have you heard in regards to people who are using continuous glucose monitors? Vinegar, yes, definitely. That's definite. Any others? No? Yeah. Food order, yeah, definitely. Any others? Say that again. Preloading? Yeah. Any others? Yeah, okay. So there is loads. I've just named a few. Okay, so we've got your vinegar drinks, protein with meals, high fat, low carb, personalised nutrition plans like, you've got Zoe and other companies out there, exercise following meals, fibre first, macro, micro sequencing, and that list isn't exhausted. There's so many things that are out there that people are saying, you need to do this to keep your blood sugars low, okay? Okay, so what I thought I'll do is, I'll go through some of the trends that people have been talking about. It's only a few. I think I've got 3 here. However, I will be putting more and more on my social media because I've done more, but I knew that we were going to be strapped for time. So there is a lot of information out there when it comes to drinking vinegar, and it's not necessarily just apple cider vinegar. It's vinegar. Any vinegar that has acetic acid of about typically 5%. Okay, so if someone does have diabetes or they're metabolically unhealthy, so they might have diabetes and obesity, it does show us that having some vinegar, so that's probably typically like a teaspoon within a glass of water, can improve your fasting glucose levels, your HbA1c, your LDL. But that is for those people who are living with type 2 diabetes and obesity. As a clinician, I always still skeptical to suggest this in clinic because I always think it's that thing, isn't it, where if people think, well, if I can do this, I don't need to do anything else. When really, if we work on the foundation, of our health and nutrition and lifestyle before we start throwing in these little hacks and trends, but that's my personal view. The research does say that it does support us there, okay? It helps slow down the digestion of high glycemic food, which as a consequence reduces the blood glucose response. However, if you don't have diabetes, it does suggest that you're not really going to get much benefits from it. Now, that's not the information you get online. The information you get online is that if you use vinegar, it's going to do this and it's going to do that, and it's going to really improve your health. So really, it's taking some of this information with a pinch of salt, maybe looking into it a little bit further. And secondly, I'll just throw another question out there. Keeping your blood sugars really low if you don't have diabetes, is that a good thing? Yeah, that's really a question for people to think about. That's the vinegar one. So there is research in regards to people who do live with diabetes, type 2 diabetes and obesity. Then you've got fibre first. Now, fibre first, the research, this kind of really took me down a rabbit hole because there is a lot of research out there in regards to fibre first or adding fibre to your meal. So there's two different concepts there, isn't there? And, having a diet rich in fruit and vegetables is something that we recommend anyway. It's something as dietitians you probably tell people, ask people how much portions of fruit and vegetables have you had in your meal. So without even the concept of managing your glucose, your blood glucose levels, I would say that's something we should be promoting anyway, as we probably all are. But we have found that people that do have more fibre in their diet, it does have a good response in regards to their glucose levels, okay, and it reduces it somewhat so, okay. So I've got some here, and this is like, a little bit of the science in regards to behind it and how it all works. So again, there is research out there that does support people having increased fibre in their diet. Now, when we say fibre first, though, there was limited information that I found that said if you have it first, it's going to reduce your blood glucose levels. But if you think about it, if you had your meal and you've got your plate, you've got 50% of your plate which is full of vegetables, and you ate that first, how's it going to make you feel? Yeah, it's going to make you feel because it's quite a lot of volume, isn't it? You're getting a lot of fibre. So that's going to have a knock-on effect on how much probably carbohydrate you have and also protein. So from a practical point of view, again, you can see how that can work. Yeah. Okay. Then we've got exercise after meals. Now, this is one of my gold standards. This is one that I do recommend quite a lot anyway. A lot of when we eat, 80% of our glucose is taken up by our muscles. So if you have a large meal which has quite a lot of carbohydrates in it, and then we do go and do like a 15-minute exercise after, you're going to be using the largest muscles in your body, you know, and you're going to be pulling some of that glucose from your bloodstream into your muscles. So it's going to have a positive impact on your glucose levels, full stop, okay? And then again, we've got your insulin resistance. This helps to improve insulin resistance, even if you're doing it before, after, or whenever you choose. So again, it's something that we're going to recommend. I think the two ladies that have spoken before me, they've spoke about exercise. And to be honest, exercise is a win-win, isn't it? As long as you're doing something that you enjoy and you can consistently do it, you are going to see benefits. But then if you go down to point 3 here, this is where we start talking about more specifically in regards to diabetes and insulin resistance. So if you're trying to reverse insulin resistance, you will find that exercise is going to support that. But if your diabetes has progressed and you've got beta cell destruction, that's when it gets a little bit complicated. So the advice that you'd give somebody with diabetes is not just you need to lose weight to reverse it. You know, it's really thinking about the pathology of why someone's developed it. And in the UK, we don't have the mechanisms and the resources to do all of the exams, you know, that we would want to do on a patient to really find out why have they developed type 2 diabetes. And if we did, it would be good. But, you know, as we all know, there's research being done and it will continue to develop. So under normal conditions, postprandial glucose uptake into the muscle increases linear, linear with time. Does that make sense to everybody? That sentence there, yeah? Okay, so all in all, the 3 that I've just put up there, you can see that there are benefits in regards to glucose management. But then there are other ones out there, aren't there? So, you know, in regards to if you eat more fats, you know, your blood glucose levels is going to be lower. But really, that really, how can I put it? That makes us think about, you know, your general health as a whole. You know, if you're going to be eating butter, you know, over eating a balanced meal just because your blood glucose levels is lower, that's not going to put you in a good stead for general health as a whole. So here's a good question here. Could reviewing a healthy person's blood glucose variability with the use of a CGM be a tool to identify metabolic dysfunction before it's too late? What do you think? So basically what our question is asking is, do you think using a CGM could be a tool that we could use to support somebody before they develop pre-diabetes or even type 2 diabetes? Especially to everyone that said no. What do you think?
I think it could be a tool, but it opens Pandora's box, really, because if that person isn't monitoring it in that way, you know, they could become fixated on what they're eating and just,
Very true.
eating disorders.
Yeah. So did everyone hear the answer? Yeah. So and that's really one of the biggest things that's coming through, isn't it? You know, you've got this machine, it's throwing data out. Do you understand the data? You know, as I said, if you eat butter, your blood glucose level is going to be lower, so you're going to stay on butter rather than having, you know, some toast or some pasta. And I think that's where it really goes a little bit wrong. It's going a bit haywire because people don't understand the science behind it. So before I go into the case study, I thought I'd put a little bit of information here regarding glucose variability and excursion. So this is what people are talking about, the peaks and the troughs, you know. I've had a meal and oh my goodness, my blood glucose level has shot up. Yeah. Is that a good thing? Is that a bad thing? Yeah. For people with diabetes, glycemic variability can provide an insight into affecting their blood glucose, can't get my words out, diabetes management therapy. And it really can help them. And I mean, to be honest, with people with diabetes, especially type 1, it's a lifeline to be able to have it. You're not having to prick your finger all the time. You have people who don't have access to even washing their hands because they're whatever job they're having, so they can just scan. It's great. But today we're really talking about the people who don't have diabetes. Is it a good idea for those to have it? So here it says research on optimal glucose variability for people without diabetes. They don't have any metabolic dysfunction. It's limited. So the information is really, really limited there. So again, as you said, you're opening Pandora's box there because, they're going to start getting fixated on certain things that probably don't really make much difference. Or you could be, their nutrition could becoming inadequate because they're removing things just to keep those glucose levels down. So we've got typically blood glucose levels for people without metabolic syndrome normally remains within a quite tight range. So I did my own little experiment at home with my husband, bless him. I fitted one and I says, right, I want to see how it works for him. And it was really, really interesting. And that was really true. I know it's only one person, so, it's not studied by far. But we did find that, don't judge, he's a dietitian. He did have a mocha packet of crisps and I think two biscuits with the kids. And it went up. So it didn't stay within normal range. However, it came back down. But for him, it was like, right, okay. So that little treat fest that I just had there, maybe I will adapt it. So I would say that's a positive outcome for him. But then he did sort of say, well, regardless of what else I eat, my blood sugars are okay, so I can continue doing what I'm doing, even if it's healthy or not. So, so here, there, and everywhere. So, so this is just a bit of information here about the excursions and the variability. And what we need to remember is if you don't have diabetes, your blood sugars is going to go up. And it needs to go up. We need it to go up from a physiological point of view so we can release that insulin, and then it can start bringing it down. So we need it to go up. So here's my little case study here. So we've got a 45-year-old lady. The reason why I've used sorry, mistake there. Got a 45-year-old lady, and the reason why I used 45 is because you're supposed to have your health check around 40, that MOT, which I'm noticing not a lot of people are getting, but you're supposed to have that around 40. Her weight is 110, BMI is around 40, and she's got quite a lot of central obesity. Besides that, she has no other health concerns. Yeah, she's not on any medication. But she's been on social media and she's decided, right, I'm gonna get one of those CGMs. I'm gonna fit it. But she's been wearing it for a while and she's found that the excursions are greater than 11 millimoles per litre. Do I need to go back to the side to see the diagnosis? So that would, if it was a fasting oral glucose fasting test, then she'd be reaching the type 2 diabetes ranges for that. She's not been previously diagnosed with diabetes or pre-diabetes. She's been to the GP and her HbA1c has come back as 40. So not quite pre-diabetes. What are your thoughts?
I think it really depends on how she's feeling about it. Like if it motivates her or encourages her to make good food choices and she's feeling really positive about it, then potentially yes. If it's giving her anxiety, then perhaps no. So that's why I like that, because it can work really well for some people but can be really detrimental to others. Yeah, definitely.
Some cost factors, if she could be investing that into getting more fit rather than spending on the CGM.
Okay, so the cost factors behind it. Where her priorities.
Tim Spector soon for a personalised plan.
Say that again.
It's the next level. Paying Tim Spector for a personalised plan. That's the next level.
Well, there is that, isn't there? Yes. Okay. So really, it's dependent on that person, isn't it? It's dependent on that person and how they are using their CGM. And the reason why I put this as a case study is because, wearing her CGM was the reason why she ended up going to the GP. She didn't have an MOT when she was 40. Okay, so it has provided her with that insight to, things are not going quite according to plan. So she could use this CGM now to say, right, I'm going to improve my nutritional intake. I'm going to improve my lifestyle. I'm going to start doing some exercises. But then the question is, where is she getting that information from? You know, because if it's all you're all relying on social media and Dr. Google, it could tell you all sorts. You know, she needs to go on a keto diet or something. That's what Dr. Google could tell you. However, I think this is where the controversy comes into play, and it's a bit 50-50. Some people would say, no, she doesn't need it. She doesn't need a CGM. And some people will say, well, I think it's been a positive thing. Let's use it for a little while because it might motivate her. It might make some changes to her diet and her lifestyle. So as I said, there's no right or wrong answers to this. But as a healthcare professional, if I was to see her and she was using it, I wouldn't deter her from using it. I'd say if you choose to, that's fine. But I'd give her some practical tips on how she can start improving some of her diet and lifestyle to try and bring down those variations in regards to her blood glucose levels. Okay. Has anyone else got any input on that? Would anyone do anything different? Or was anyone sitting there thinking, no, I would not let her use that any longer? No?
I think it's what you're saying, Rose, the difference that, you know, the way that's going, you're seeing Zoe and all these that basically just get this data and give people a plan.
Yeah.
I think that's the huge challenge. Whereas as a dietitian, you know, what is best for that person in that context. I think
Definitely.
that's the problem when that is not used at all, then it's a recipe for disaster, I think.
And I went on to some of these personalised plans just being a bit nosy, to be honest, just to see, you know, how much do they cost and what does it look like. And there's quite a lot of work you've got to do, you know, store samples, sending data, things, and then you've got the cost. And really, when it comes to improving your diet and lifestyle for type 2 diabetes and a lot of other conditions, it's creating habits that you're going to be able to sustain. Well, you know, depending on your income, can you sustain something as expensive as these personalised plans? And even if you can, sometimes I've noticed that no matter how much somebody's paying, that doesn't have an impact on their diet and lifestyle or improvement of their conditions. It's more to do, are they getting the right information and how motivating, consistent can they be with the information that you're giving them? So it really has to be practical. But in regards to it highlighting that some, you know, things are a little bit out of sync, I'm all for that. That's absolutely fine. But the longevity of it, that's where the question comes into play. So, takeaways. Okay. I think CGMs are here to stay. Should I even dare say? But I do. I think they're here to stay. You know, a lot of us are sitting wearing watches, health trackers and things like that. Technology is always going to evolve. Yeah, so I think CGMs are here to stay. But I think it's really important, you know, the information that we're putting out there, especially as healthcare professionals. You know, how can we support people who are choosing to use a CGM? Okay. But then it's really being mindful that the data out there is really limited. So if I was to say to you, someone starts wearing a CGM, they've just had a meal, and their blood glucose levels has, you know, it shot up by about, I don't know, 4 millimoles per litre. Okay, there are some research that says anything above 1.7 millimoles per litre. There's some endocrinologists, especially in America, that are saying, well, that's a little bit too high. We don't want it to shoot up more than 30 mg deciliters. That's the units they use there. But then there's also research against that. So at the moment, it's such grey ground that, you know, you can't really say what is right from wrong. However, if it was to stay elevated, I think that's the most important thing. That's when we would use that information to go on and speak to a healthcare professional. But those with diabetes, of course, they're going to continue to use it. It's a positive thing. They're going to get the input from their healthcare professionals, so they can interpret the data, that, you know, the information, that's the feedback that they're getting. And then just to conclude, if a person feels to use it, it motivates them, improves their nutritional intake, then that's fine. But to be honest, there's no better advice than advice from a dietitian, which again, probably quite biased. No, but it really, you know, because the thing is, we're spending our time, you know, doing the research and looking into it, and we're not looking at it from just a financial standpoint. And I think CGMs have really been, you know, coupled with the fact that, you know, there is a financial gain for some companies in regards to it. And we're not looking at it from that. I'm looking from a holistic health point of view, and can that help somebody? Can that support somebody? As I said, it's a controversial topic, and I think it's one of those things where you just say, "We'll watch this space," because it's not going anywhere. It is here to stay, and we'll see how it pans out. But some practical tips. So I've done 2 columns here for people with diabetes. That's the information that would give them there. For people without diabetes, you know, activity. You know, it's number one, and I would say activity for me is always going to be number one. I think muscle mass is under researched in regards to diabetes. You know, you've got black bush diabetes, and you find that it happens in Afro-Caribbean men where they've got diabetes for a while, and then it's like it just stops. Yeah, and then it comes back again. And that's something that's, you know, we do believe is linked to muscle mass. Then you've got your healthy, balanced diet. That's really important. And protein, as you were saying, ensuring that they, you know, get adequate protein. And sustainable habits. I mean, that sounds quite fluffy, but to be honest, I think it's a really pivotal point, because if you're starting something that you can't sustain, it's just not really going to help you in the long term. And then opting for fibre in your diet, I think that's really important as well, from a cardiovascular point of view, from a diabetes point of view, and, you know, all other aspects. And that's me, really. As I said, this is literally a whistle-stop tour of this topic. There's so much more information that's going to be coming out about it. We continue working on the research out there, but CGMs, they're here to stay. The information is limited for those who don't have diabetes, but I would just say to be open-minded, really, and you know, think of it through the big picture rather than no, someone shouldn't have it. I sound like I'm going for it, doesn't it? I've just realised I'm not. I'm just here just trying to get the research and sort of put it out there and just highlight the fact that it's one of those mechanisms that, you know, like our watches, and, you know, you've got these machines where you can do, is it your heart trace? There's so much technology that's coming out. And as dietitians, it's really important that we stay open-minded and, you know, look at the research rather than just be like, no. Thank you.